I'm really curious to hear where you started, because you had a bit of an unusual journey. So if we go back to the very beginning, where did you start?
I've always been very interested in research. I think I knew quite early that I wanted into the medical field and doing research.
What inspired you to go into that part from early on?
I think it's just been an interest from the beginning.
Yeah.
When I was a child, I thought healthcare hospitals were fascinating places. I've always had an interest in that. So I think it was quite natural to become something within that field. So I was thinking maybe a nurse or a doctor or a researcher or something like that. So it's been quite natural for me, I think. And then I moved to Uppsala and I did my PhD there. I attended a research school because I was new in town. And I thought this research school was very important.
What is a research school?
It's a preparing year. You can apply for these research schools. At that time, we had 5 research schools in Sweden, in different towns, and Uppsala had one. Applied there, got accepted, and then you get a whole year of preparational studies before you go into your PhD. And you get to try different projects. And that was very exciting. So you got a project catalog where you actually could choose different projects within the medical field.
That sounds exciting.
It was very exciting. And you could really try out different research fields. And I think that was very important.
Yeah.
To find your own way. What are you interested in? Where do I want to do my PhD? And then I found the pathology field.
Yeah.
And ended up there, within cancer research.
So what did you do?
I was in a large Swedish project called the Human Protein Atlas Project. I think it's one of the biggest one in Sweden. And we were supposed to look for all human proteins in different types of tissues and compare with the most common cancer types to see different protein expressions. I think it was the 20 most common cancer types compared to normal tissues. So that's what I did.
After your PhD, you made a bit of an unusual choice.
Yes.
Can you tell us about that?
Yes. And during my PhD, I did some teaching. We had to go through a teaching course. All PhD students in Uppsala University have to go to a compulsory teaching course. So I went there. And I thought that was so exciting. I got really inspired and engaged into teaching. And after that, you teach 20% of your time. So after my PhD studies, I thought this was so exciting. I think I want to try it out. So I worked as a teacher at Uppsala University for some time after that. And I think I more got into that field. But I was also interested in research, but I didn't need to do the research myself. So that's why I kind of changed.
Yes. So tell us a little bit about what you're doing now.
So now I work for Biobank Sweden, some part, and I also work for Uppsala Biobank in Uppsala. So I think the good thing is that I get to do both now. I get to work with researchers, read exciting ethical applications about new research ideas and things they want to study, and also give advice. I give regulatory advice on how to collect samples, what kind of things you need to think about when you're conducting a study, how to start, where can I find samples, for example. And I also get to teach. So I'm teaching at the Uppsala University and also at the academic hospital in Uppsala. So I get to meet different types of target groups, both PhD students, for example, at the university, to inspire them and teach them what to think about in the beginning of their studies, but also experienced researchers and research nurses, for example.
Right. Yeah.
Very important target group.
Absolutely. So how did you come into this kind of biobanking world?
I think it was a coincidence somehow. I knew a little bit about biobanking. It was quite new when I did my PhD. Actually, when I conducted my PhD studies, I did not know what a biobank was. It was quite new in Uppsala as well and in Sweden. But then you hear more about it and you learn more. And then I got interested because since I had a PhD, I'm interested in research and research studies, but I didn't need to do the research myself as a researcher, but rather give support. I thought that was a good combination, that I had a good background for the biobank.
So tell us a little bit about that type of approach, like when you don't do the research yourself, but this whole, like, because there's a lot of different kind of support functions, right, that scientists needs.
Yeah.
Can you share some of your experience with that?
Yes. So I work a lot with support and guidance. And I think it's so important because the researchers, they are so good at what they do. I mean, they're interested in research. They should be able to put all their time into their studies, planning, doing, getting results. And there's so many things prior to starting a study that you need to know about how to start a study, where to find samples, legislations in Sweden. What do you need to think about? What kind of applications do you need as a researcher? So that type of support is so important. So if we can support them with that, to give them guidance, help them out in the best way we can, to ease that administrative part, so the researchers can get that type of help from us and focus on their study, getting results, maybe getting back to the patients with good treatments or things like that. And there are different support functions. In Sweden, we have Biobank Sweden, of course, a good network and infrastructure. We have a web page as well where you can access a lot of information on where to start, who to contact if you have questions.
So do you draw on your own experience as a scientist in this type of work?
Yes, very much. That's why I appreciate my background within pathology. So I can give them support in that sense as well. I know the challenges because I've been there myself, and get a good understanding for what they do.
Yeah.
And try to help them in the best way I can.
Is it a lot you had to learn on the job as well?
It is. Different types of fields, of course. And also gathering information. What do they need to know? What's new? We had a new biobank legislation in Sweden. Since 1st of July 2023. So it's approximately a little bit more than 1 year old. And then we tried to, change all the documents, all the information going out, because there's a new legislation. And what does that mean for the researchers? What do they need to think about? So it's been a lot of work.
Like, we all know the academic job market can be pretty tough.
Yeah.
But it's not talked about as much with this kind of administrative or support, like, kind of career tracks. So what would you say for, like, say, a PhD student completing their studies now, being unsure about where to go? How do you, because you've made some very brave choices, I think,
Thank
in
you.
doing like this untraditional route.
Yeah.
So what would you think for people starting out like that now?
I would say contact people, talk to people in different fields, and find out what you're interested in and what you really want to do. Some people are really dedicated into research, and that's, their way, their career way from the beginning. But then we have people like me who are thinking about other things, and then you kind of find out by talking to people, trying things out. I was lucky to get into this teaching course and got inspired and talked to the people working at this teaching course. How did they end up here? This is so interesting. And they really inspired me to teach myself. And then I became a teacher for other teachers at the university, giving them advice how to teach to students. So that was kind of my way. So I would say find your way and talk to people and be brave enough to try out different things.
Right. Yes. And you also told me you recently even got to talk to young students, right?
Yes, very, very young students. So we have this scientific festival called SciFest in Uppsala. It's Uppsala University and SLU in Uppsala who's arranging this. And they want to inspire children and young people in school to the research field. And I think it's a really nice initiative. It's been going on for several years now. And Uppsala Biobank, we are always there talking about biobanks for the children. And they are from 8 years and up.
Yeah. How did they respond to that? What do they think about the biobank?
They think it's funny.
Yeah.
Because we always ask, like, what do you think a biobank is? It's a bank with things in, maybe money or something else. And we're like, yeah, bio is more like biological material. And then we have a station where they can try out pipetting. So they have this pipette, so they can actually pipette fake blood into different tubes.
They must love that.
Yeah, they love that. And they think it's so exciting. And during this time, when they're very focused on their pipetting, we try to talk to them, just asking them, have you taken a blood test sometime? What do you think about that? Do you know that you can do research on these type of samples and things like that? And then also having real examples, like, for example, we have vaccination programs today, or we have treatments for different diseases, thanks to donors that actually donated blood samples or other type of samples. And it's very exciting.
Yeah.
And it's very nice to hear their questions and just getting them interested into this field. Maybe they will have an interest in becoming a researcher in the future, or maybe they will become donors. So a very nice event.
That sounds exciting. Because the biobank has this unusual position in society, right? Because they're close to the university and the scientific environment, but then also very close to the public.
Yes, and healthcare. So we're kind of integrated into all of these three parts.
Coming back a little bit to the meeting here today, how has it been like meeting your colleagues from around the Nordic countries?
Yeah, it's been great.
Yeah?
Yeah, really, really great. It's not so often that you get this opportunity to actually talk to biobank colleagues in the Nordic countries. And it's been very inspiring talking to them and just to hear about their infrastructure, how they have built up their way of supporting researchers, and also taking some things back home, thinking about how can we be better in networking. Can we be inspired from some things or get new contacts or collaborations? So I think it's been a great meeting.
Sounds really good. How do you see the collaboration between the biobanks? Both, like, I'm curious also in Sweden, but also between Sweden, Norway, Denmark, Finland, the other Nordic countries.
I think in Sweden, we have Biobank Sweden as the infrastructure. And it's a whole national community. So we meet quite often in different working groups, working together nationally towards harmonizing processes and talking to each other, sharing experiences. So I think it's a very good and fruitful network. When it comes to the Nordic countries, I don't have that much experience myself from collaborating with them, but I really see a lot of opportunities when you're here listening about the different projects, and I really hope that we can get the collaboration and networking, that we can be better at that, and also that the conference can continue so you can meet again.
So looking ahead a couple of years, the next, let's say, 10 to 20 years, how do you think the biobank community will be?
I hope that we have harmonized things in an even better way than today, making it easier for research to access samples, that we can have kind of a one way in. I was very inspired by Finland, who have this one way in for the researchers. They have, of course, less biobanks than we have in Sweden. So it's
there's
perhaps
many in Sweden?
We have very many in Sweden, I would say.
Yeah.
They have, I think it's 6 or 8 within healthcare and 11 in total. So, of course, it's easier in that sense. But I was very inspired regarding the way they handle things. And I tried to ask them, how do they work? Who applies and who take care of the applications for accessing samples, and how do you cooperate? So that was very inspiring. And I hope we can have something similar in Sweden. Maybe it's not completely possible in the exact same way because we have so many biobanks. We have just 21 regions in Sweden with a biobank each, at least.
Right.
So we have quite a lot.
Yeah.
But hopefully a better harmonization for the
Yes.
researchers' sake.
Yeah.
And also reach out to the community, to the public, to inform about how important it is with biobank samples and all the good results that come out of it.
How is the biobanks viewed by the public in Sweden? Is there a lot of trust?
I would say there's quite a lot of trust. We were discussing that actually yesterday, the Ethics Cafe, and I thought that was very interesting. My experience is that we have a lot of trust in Sweden for the system and for biobanks, and people are very keen on donating samples to research. There are very few samples that are not donated within the healthcare system. But yesterday's discussion was interesting because they foresee that the trust might be an issue in the future. So we really need to keep on informing and keep up the work, not forgetting about the importance of trust.
Yeah, but why do you think it will be, or it could come up as an issue in the future?
They were discussing that with AI coming up and these type of things, that people might be a bit skeptic and also perhaps a bit afraid. What can AI do? Can they take my data? Can they do something that I'm not, that I don't want them to do? Can they access data, and how? And I think that might actually affect the trust.
How can the biobank community build trust with the public?
I think by information, talking about biobanks and the importance of biobanks, and also be transparent in how we work and what we do. I think that's a good way to start, at least.
Yes. So that takes us a little bit back to the science communication.
Yeah.
It's an important topic also for biobanks.
Yeah, it is. And also for, informing people what happens with your samples. You can donate a sample to a research project, but also the outcome of the project. What use did we have, for example? We have done so many great research projects. We heard a lot today and yesterday here at the conference, results from the different research projects using biobank samples. And I think it's important to talk about this and present it in a very easy way so that the public really can understand the importance.
Yes, because there is really a lot of excellent research, big discoveries being made, right?
Absolutely.
Does that feel inspired for you also when you go to your day job and you advise these scientists on because going through paperwork and legislations can be not so exciting.
True. Yes, of course it is. It is very exciting. And it's absolutely true that there's a lot of paperwork and challenges for us as well, of course. But I'm always inspired reading all the ethical applications and the exciting projects and ideas that researchers have.
Well, thank you for coming and for sharing your story. I think it's absolutely phenomenal that we have people like you who are so excited to make science happen.
Thank you very much.